Okay, thank you very much for coming today. I'm excited to have Professor Reine Meylaerts, who is going to talk to us today. As you know, Professor Meylaerts is full professor at the Department of Translation Studies at QU Leuven. She has been in several leading roles inside and outside the university, including as Vice Rector of Research Policy, Vice Rector of Social Sciences and Humanities, Director of CETRA, that is to say, the Center for Translation Studies, and also Secretary General of the European Society for Translation Studies. These roles include both past and current ones. Her research interests include translation policy, especially in relation to minorities, and intercultural mediation and transfer in multilingual cultures. She has published more than 150 research outputs, was keynote speaker at some 40 conferences and workshops, and she has also been lecturing at many international universities, including, for example, Harvard University, Beijing Foreign Studies University, Beihang University, and Copenhagen University. Thank you very much, Professor Meylaerts, for joining us. It's a pleasure to have you, and over to you.
Thank you, Mustafa. You can hear me all? Okay. Good evening, it's for you. I'm in Belgium, Leuven, so it's in the morning. Anyway, thank you for being there. I apologize for the misunderstanding of last week, but I'm very glad that we can meet today and that we can have this session together today. As Mustafa already said, you are open to have questions. I hope we can engage in a conversation, but rather at the end of my talk. Of course, if there is really a very pressing a question that you need to ask during my presentation, please feel free. I think the number of participants leaves us that room. We are not 100 people, far from that. So I think that gives us a bit more freedom. So if you really need to ask a question during my presentation, I'm really open to that also. And otherwise, I welcome questions, of course, after my presentation. So as you can see from the title of my presentation, it's a methodological intervention, or it's a methodological presentation with a question, and I think I will be asking more questions than giving answers, but I think that's very important in research, and that's also how I hope to engage in a discussion. So let me start by trying to explain to you what is the problem that I would like to address to you. And I first need to tell you that this is a presentation that is based on a joint research project that is carried out by two doctoral students, Khadija Boyzorn and Rachel McCready. I think Rachel is not there today. She told me that she was there last week, but unfortunately I was not there anyway. And we do this together with Anthony Pym and us myself. And it's a project about going towards effective translation policies and practices for official communication, as you can read, with CAL communities in Brussels and Melbourne. So I will be talking about the research that we did together. We have also published about this. If you would be interested, I can give you more details about that. First of all, of course, I need to give you a definition about or definition of translation policy. What definition will I be working with here for now? Of course, there are many definitions of translation policy. I am basing my presentation today on a definition that is inspired. It's not completely the same, but it's inspired by Spolsky, 2012, Spolsky's definition of language policy. As you know, in the field of language policy, they did not speak about translation policy, and I think they were wrong. So here you see on the screen the definitions that I would like to work with for today. Translation policies, the legal efforts by authorities to initiate, impose, or restrain translation practices. So, in fact, it's a very it's a narrow view, if I may say so. It is about communication between authorities and the people, between authorities and the citizens. So it's not about private communication. It's only that part of communication between authorities and the people that I'm speaking of, and policy here is then the legal efforts made by the authorities to regulate this communication, which of course is very important in every democracy. Communication between the people and the authorities is key. Anyway, translation practices, all the interlingual activities. I presume you are translation scholars, all of you, so I will not go further into that. And translation beliefs are the various values assigned by members of a language group to translations. Is the definition that I work with. And once again, it's inspired by Spolsky's definition of language policy. So please keep that in mind, but I will come back to that during my presentation. Now, very important for my presentation is the fact that Spolsky says that if policy wants to be effective, it must be consistent with practices and beliefs. Then you have an effective policy. If there is consistency between the three parts, and of course, this also goes for translation policy. And the question then here is, and our question in our research project was, how should we then study situations where those factors do not concord with each other, where there is a gap, so to say, between the three elements of the policy, the policy, the practices, and the beliefs. And the goal, as I told you in the beginning here, is to reflect on the methodology. How can we study these kind of situations, and what are the problems? Because I will mainly be speaking about the problems that are encountered in these kinds of situations. Now, as I told you, we in our project, we approach these problems through a double case study on Brussels and Melbourne during COVID-19 pandemic. So this is the very concrete situation that we studied. Brussels and Melbourne, well, because we were based in Belgium and in Australia, but also because these are two very interesting, very super diverse cities. They are among the most diverse in the world, and they are also, in many respects, they are different. And so if we wanted to compare the situation in these two cities, this brought some extra methodological problems to our project, and that's what I will be speaking about in everything that follows. So the focus is on Brussels and Melbourne. The time frame is the COVID-19 pandemic, and we had many indications that during COVID there was a change in translation practice and translation beliefs, but not in policy. So we quite quickly noticed this gap between policy, practice, and beliefs. And so our question was how to approach this gap with a methodological sound framework. And we noticed also that there was little in the literature about that. Perhaps a few more words about the change in the practice and the change in the in beliefs. What did we notice? Well, the change in practice was mainly the use and the growing use during COVID pandemic, the growing use of non-professional mediators or translators. That was an important change in practice that we noticed. And the change in beliefs was the acceptance that healthcare communication could be much more than, let me say, an accurate translation, a straight translation as we as translation professionals would know it. That, in a nutshell, were the changes that we noticed, and that brought us to this question about how to approach this gap, because as we also noticed, the policies themselves did not change. Okay, a few more words about the selections that we made for the overall study. So this is more in general the methodological choices that we made. Of course, we did not focus on all the languages, super diversities, Melbourne and Brussels. We selected a number of languages. For Brussels, we focused on standard Arabic and on the Moroccan variety of Arabic, and also on Amazigh. One of the reasons was that the researcher, so Kadisha, she was also speaking these languages, and also 10% of the inhabitants of Brussels have this background. For Melbourne, Rachel focused on standard Arabic and Dari. She was not speaking herself these languages, but these are also important minority languages in Melbourne, with 20 to 20% of non-English proficient speakers of these languages in Melbourne. So these are the languages that we were focusing on. And in general, we adopted a mixed method design that you can see here, the most important elements of which you can see here. I think it's quite straightforward. And what I will do in the following now is that on each of these 5 elements of our mixed methods design, focusing on the problems that we encountered while doing this study. So this will come back. I think this doesn't need much more explanation for now. So each of the steps that you saw in the previous slide is quite straightforward step or way of gathering data, but each of these steps involved also certain constraints, certain challenges, certain problems on the way the data was gathered, or on the way we could gather the data, but also in the way we could interpret the data. And it is more specifically on these elements that I will try to focus, and that I will try to share with you the difficulties, the problems that we encountered. And we try to formulate these questions as you see them here in the slide. So it's about reflecting on our own methodological approach, and we phrased it in terms like, whose voices do we listen to in order to have a better grip on the practices and also on the beliefs. Voices, of course, also sometimes in a more figurative way. And I will clarify that. This will be clearer in the reminder of the presentation. And within this broad question, whose voices do we listen to, we also were asking, or we also were struggling with, how can we deal with evolving beliefs? How can we deal with contradicting beliefs? Because that were all the elements that we encountered. And then finally, how can we make the policy more effective? So these were the questions that, while following the methodology that you saw in the previous slide, that we encountered, and that is what I would like to reflect with you upon in the following. So I will discuss the methodological challenges that we encountered at each of these steps, and I will do it in a way in the order in which we also did this while doing the research. So it's a bit an intuitive approach, but we thought it was very useful to reflect on these and to share. By the way, we have published on that, so to share these elements with you today here. Okay, so whose voices do we listen to in order to better answer, let's hope, the questions that we had raised, at least in our research? Well, quite straightforward, I think. Any policy research should analyze the policy documents. What does the actual policy tell you? And I think this is something that is not always, or that is perhaps not even often done in translation studies research. We think that it's very important to analyze these policy documents. What do the law say? What does the law say? So here, specifically on the two cities that we were focusing on, for Melbourne, of course, you have here the Australian policy. The official language policy has English as the de facto, not as the de jure official language. And the law says that translation is provided where essential information needs to be communicated to inform decision-making. Quite vague. What is essential information? What is when is it needed for decision making? Also, translators should be certified. That's enough for now. Let's have a look at Brussels. In Brussels, and that's also part of the Belgian language policy. Brussels is a bilingual city. Official language policy has Dutch and French as the official languages, and that means that all official documents and government services must be available in those two languages. That's the official policy for Brussels, and you immediately realize that the policy is quite different, or is completely different for the two cities, which of course can bring methodological challenges. What you also notice, I think, immediately, is that in these policies, you don't have anything on community-based translation solutions. And you might remember that this is something that we noticed during COVID. There were practices such as re-narrating vaccination messages. We are in the COVID time, through WhatsApp, spoken messages in different languages. Well, you know the languages that we focused on. Also by community members going on the spot in different places with the faxi buses. This is a bus this is an example for Brussels. So vaccination buses with community members in the bus present, where people would come to the bus and where you would have translation on the spot by a non-professional translator, in order to have people vaccinated. These are only two examples, but these were the practices that we noticed, while the policy was what or stayed what I said in the previous slide. So no community-based translation solutions, and so we witnessed this gap. between the policy and the practices. And we were asking ourselves, so did practices and beliefs evolve ahead of policy or beyond official policy? And in a certain way, especially in Brussels, this is not legal. The law says you can only have official messages in these two languages and nothing else. Anyway, so we were asking ourselves, whom should we ask about that? Whom should we listen to? And in more general methodological terms, I think it's always important that while you need to look at the policy, while you need to study the legal documents, you should always look also at the practices. What is the relation between the policy and the practices? Just looking at the policy is not enough, at least if you want to see if policy is effective. And always go to the practices. Okay, since we are in COVID times, we thought that a way of testing the effectiveness of the policy was to see how many people were vaccinated. What is the effectiveness of the policy? In this case, what is the effectiveness of vaccination information? Did people get their vaccination in the two cities? And speaking of so diverse cities with so many languages and so many called communities, for that, of course, it's also important to know the preferred language of the people, the native language and or the preferred language of the people. And therefore, you need information on language use, quite straightforward. And that's what we tried to examine for the two cities. Now, for Melbourne, this was quite straightforward. You have official, as you might all know, you have official language censuses in Australia, for the whole of Australia, with very detailed language maps for each local government area. And this, for Melbourne, this means that there is one area with the highest concentration of Arabic speakers, which is the Hume area. I'm not familiar with that area, but this is, of course, what the data told. And what we saw then during COVID is that the vaccination rate in Hume rose only after non-professional community-based mediation was started. Of course, there is no direct causal relationship between the two. There is a link, but you cannot infer from that a cause-effect relationship. To give one example, our researcher, Rachel, found that one other cause for a vaccination was that people could not go to work unless they were vaccinated. Okay, but we had this link in a way between vaccination and non-professional community-based mediation. So far, for the moment, for Melbourne. What about Brussels? Well, in Belgium, there are no language censuses, no data on language use in terms of language censuses is politically too sensitive. But luckily, there are academic surveys where you can have a more general view than you would have in Australia, but you can have information on native languages, languages spoken at home, and so on. So there are some data. And it showed through these data that in Brussels, there was also an increase in vaccination rates after the implementation of decentralized, of non-professional vaccination strategies. Think of the vaccine buses, for instance. But Once again, this is no indication of actual causation. So if I would need to summarize for the moment, these language censuses and the link between native languages spoken and, for the COVID situation, vaccination is important to know, but it is not sufficient. And so we had more, we needed more information. We needed more information on the gaps that we noticed. And in a way, we understood better that the difficulties that we as researchers had to know who speaks what language and to reach out to these communities, of course, were also the difficulties that were faced by the policymakers during COVID. How to reach these communities. And of course, that is linked to the policy, and that is linked also to the data that you have. But these gaps in the language data illustrate, not only for us as researchers, but also for the policy makers, the difficulties. And that, as we noticed, was one of the reasons why the authorities, why the policymakers turned to community organizations, and I will come back to that later, turned to community organizations for help on the ground, and to turn to communication in non-official channels. Once again, completely contradicting with the policy and at least for Brussels, illegal. It's forbidden to do these things, but of course you are in an emergency situation, you are in a COVID situation, and you take measures that are allowed perhaps by the emergency situation. Now, for us as researchers, at that moment, we felt that it was important to pay attention to other voices. We had the policy, we had the information on language use, but of course we needed more information, other information, in order to be able to triangulate, if you want. So pay attention to voices closer to specific context, one of which were the media. So we felt that it was important to have a look at the media, because one reason for change in translation practices is that you have a spread of beliefs about translation in the media, beliefs about communication, beliefs about COVID, vaccination, you name it. So that is also what we did in the two contexts. And our researcher from Melbourne had a look at Australian media reports. And what we found there was that there was a focus, and I hope you can recognize this coming from the same context. There was a focus on failures in healthcare messages were highlighted by the media. Examples of failures were translators using technical language that could not convince community groups, or failures in terms of information that was too brief, that was only available in a few languages, but not in the languages that were needed, information that was inaccurate. So that's the kind of focus that you found in media reports. And that was an incentive for authorities to go to communities engagement for Australia and for Melbourne. Let's have a look at Belgium. In Belgian media reports, it was different once again. They did not focus on failures, the Belgian media, but they focused on certain communities, among which the Moroccan communities, for instance, more in general, the Muslim communities, who were reluctant to follow the official guidelines, who were reluctant to have vaccination. And so in the Belgian media, you had this association between new infections and immigrant communities. So the problem in the Belgian media that was addressed was not the messaging, the failed communication, it was the receivers. And the negative focus on these communities. So once again, we had the media playing a different role, a kind of opposite role in the two cities that we had to deal with, and that we had to take into account. Next to the question, of course, also if these media reports were true. Were they true? In many cases, for instance, in Australia, our researcher found that there were not so much failures. But the question here, if these media were true, is less important than the fact that they were perceived as true. It was a kind of spreading of beliefs in the communities, both in Australia and in Brussels, both in Melbourne and in Brussels, that made certain beliefs evolve. So true or untrue was not the most important question. We concluded that media reports played an active role in the respective societies, Brussels, Melbourne, perhaps even Australia, Belgium. But they could not give us a sure indication of how policy aligned with practices and beliefs, because we had to notice once again that the policy didn't completely change, or only changed gradually. And how that came about, of course, we had to conclude that we had to pay attention to other voices, a wider and less random set of voices. Yes, this is something I have not told yet. Of course, the media is in a way a quite random set of voices. And in order to triangulate our findings, we needed other voices. You know that voice here is more in a figurative sense, so please bear with me. Okay, so what did we do more, or what else did we do? We also found it very important to listen to policymakers. I think this can be a general methodological recommendation. Any study on consistency between policy practices and beliefs, any study we think needs to listen to policymakers. Now, this is quite straightforward, and we did it through interviews and through focus groups. And it's not about that I would like to talk, but it's more specifically about some extra methodological problems that we encountered when listening to policy makers. First of all, who qualifies as a policymaker? That was one problem. And the other one, and there are of course more, but we focused on two problems. Who is considered, who qualifies as a policymaker, and how can we make sure that we also hear critical voices from these policymakers? So who qualifies as a policymaker? Well, as you know, policies, they take shape in, let's say, policy departments. They might have different names in different situations and in different countries, but these are very often large departments, large groups, and whenever the policy is set, in fact, the author is the only identifiable author is the department as a whole. So it is very difficult to locate one singular individual, as I call it here, one singular institutional driver, and obviously we should speak about, or we should consider kind of institutional authorship more than an individual authorship, which also means that it's not so important what specific person you talk to, because they represent the institution. So we decided that it is better to focus on this concept of institutional authorship. But then, of course, what we found is that these institutional authors, the people we spoke to, they, I should say, of course, they supported official policy. They were the spokespersons of their department of the policy. They had a kind of self-interest in supporting the policy. That also meant that they did not speak about failures. And obviously there were failures. There was failure of the official policy. The only discourse that we heard in both contexts was what I call here a kind of enlightened adaptation and organic development. We, as policymakers, our department evolved like organically to better practices. So very difficult to have critical voices. The only instance that we had was actually in Melbourne, where one policymaker told in an interview that in fact there was no dedicated policy during COVID, but that it was more about throwing money, as he or she called it, throwing money everywhere and hoping that something positive would come out. So important to listen to policymakers, but it's never sufficient to have only these voices. I think everything that I've said, I hope that this can help you also, or can make you this to have this conclusion also. And specifically, the absence of a critical voice from the policymakers is what we missed here, and that for us was a reason to talk to people. Let me call them, talk to people closer to the ground. So not only the officials. And as you might remember, what we noticed in the practices was that there was a lot of non-professional translations going on, and with the link with an increase in vaccination. So very important in our case. I don't know if that is the case for all situations, let's say outside of COVID and so on. But here in our context, very important to listen to community organizations. And here we noticed, yes, an extra challenge. Let me call it an extra challenge, because my whole talk is based on this idea of the methodological problems and the methodological challenges. Here we had another type of difference between the two elements of our research, was the positionality of the researchers involved. I think in every research, it's important to reflect on the positionality of yourself as a researcher. And here it really played an important role, in the sense that the Brussels researcher is herself a member of the community that she focused on. That gave her access, or easier access perhaps, to community organizations. It gave her also language knowledge of the community that she was, or it gives her that she has language knowledge of the community that she was approaching, that she is approaching, and she was allowed to have face-to-face surveys to gain information. This was different for the Melbourne researcher, who is not a member of the community that she studies and who has not language knowledge of the community that she studies. Both situations did work, but they are completely different and they have a different positionality. And I will go into some elements that were important in our research. First of all, the practices. If you listen to community organizations, what information did our researchers get from the community organizations in terms of practices? Well, this was pretty much the same. Similar information on the practices in Brussels and Melbourne. A lot of information about these community-led practices, the kind of evolution that we saw, a lot of information on these community-led practices that were taking place. And also a lot of information on how these communities and members of the communities helped official translations reach multilingual communities. I spoke about that. Think of reposting messages on social media, but think also on changing the medium of the message. Here, converting print or web texts. For many community people, text was a problem. It should be spoken communication, spoken audiovisual communication. And this was something that the authorities did not do, or did too little or too late. And this was something that was taken up for the good by the community organizations, both in Brussels and Melbourne. So here we have similarity in these two practices, although the situations were very different. Now, if we have a look on the beliefs of the different communities, you remember that next to the practices, it's also important to have a view on the evolution or not in translation beliefs. Well, both in Brussels and in Melbourne, we witnessed a big diversity in translation beliefs. So within the same community, you still have this big diversity. And I think it's not surprising, but it's a methodological challenge. And that's why I'm speaking about it here. These beliefs were colored by the individual roles that were taken up by the people. Are you a representative? Are you a community translator? These are just examples. These beliefs were also colored by the personal experience of translations that these people we spoke to had. These beliefs were also colored by the cultural norms. There are other studies also, for instance, showing how people with a Chinese background, they have more trust in authorities than people with other background. Beliefs were also colored by what we called self-interest. Nothing negative, but self-interest, what does it mean? Well, raising awareness of the community while you are answering the questions that the researchers were asking, raising possibilities for funding, for instance, are some elements of self-interest. And of course, in every kind of method, like the ones that we used, like surveys and interviews, think of the slide in the beginning, you need to also calculate in possible elements of bias, of course. So we had very different responses. We had also responses that evolved, and that made it very difficult for us to assess the success of any overall policy, of any practices. This is really not surprising, because we all know that policy is very context dependent. And this also means that there cannot be one size fits all regulation or guideline. If you have these diverse beliefs, and you will always encounter these, it should make especially policymakers aware of the fact that there cannot be one size fit all solution. Of course, for researchers, this is also a challenge. On top of that, and from the viewpoint of us being researchers, we needed to accept that people can say very different things, and that one and the same person's beliefs and opinions can change over time. And of course, this also can affect the success of a policy. The big question then, should policy always change? We didn't answer that question, but what we found important is that the beliefs as they are pronounced, true or not, fair or not, changing or not, we needed to accept them as they were pronounced. They were part of the data that we had to deal with, even if we noticed contradictory beliefs, even if we noticed changing beliefs. And that was something very important that we, during our research, wanted to take into account in our research. Okay, community organizations, other voices to listen to, and I'm approaching towards the end. Other voices to listen to, we thought, were of course the users of translations. And what did the people who were addressed, so the CALD communities here, the Moroccan community in Brussels, and the Dari community in Melbourne, what were they telling us? Very important. I think any research should listen to the users of translation. But very important challenge that we encountered was, who is this user of translation? The most straightforward definition would be, yes, someone who does not speak the original or official language, and someone, if you think of Melbourne, who does not speak English, or is it perhaps someone who is more comfortable with a translation? That already is an important difference, and that's the theory. But in practice, we had more difficulties. And important difficulties to locate people with complete dependence on translation. I think many researchers, the implicit idea is that a user of translation is someone who is completely dependent on translation. Well, what we saw in the results of our studies, through surveys, for instance, is that you find all kinds of overlaps, because, and this is very normal, in fact, because language skills have no cut-off point. It's more like a continuum. In some situations, you might be comfortable as a CALD community member, you might be comfortable with English, but in others, and especially healthcare situations, you are not comfortable with, let me take English as an example. We all know that in stressful situations, like COVID-19, like illness, your language, your L2 proficiency, so your proficiency in your second language, let alone your third or fourth language, you lose it, you gradually lose it. So these are the kinds of overlaps, these are the kinds of the fact that language skills have no cutoff point. And that was why we decided to have surveys for the users of translation in different languages and also to take the observation of in which language each respondent chose to answer, to take that as an element of our research. So what did that mean very concretely for our research? Well, we switched from users of translations to the idea of potential users of translation. Once again, because the cutoff point is not so straightforward. And for Brussels, this meant that we had surveys that were completed in French and online. So I told you already that we did surveys always in more than one language. And users of translations took the surveys in French, took the surveys in Dutch, but our researcher for Brussels, she also went to mosques, she also went to public places, and she interpreted in Amazigh the surveys that people then could answer in Amazigh. And this was very needed because there were people with limited literacy in Amazigh. It's a language with limited script, or it's I have to say it's a spoken language, but it's a language of the community. So it's important to reach these people also. And moreover, these people all so next to the literacy, limited literacy, they also had sometimes, especially the older people, they also had limited digital literacy. So that's why in Brussels, the researcher turned to interpreting herself, positionality. I've spoken about that, the surveys in Amazigh. The situation for Melbourne was different. There were surveys that were taken in Arabic, surveys taken in Dari, and also surveys taken in English. There was no interpreting done. Our researcher had foreseen an interpreter, but at that moment, going to the people in the community was not possible because of the very severe lockdown that was running then in Melbourne. It might ring a bell for some among you. Anyway, this made that here surveys were completely done online and were completely done without interpreting. So a big difference in the data gathering. I will come back to that. The same limited literacy though was playing in Melbourne, and also the same digital literacy was playing, which as a consequence had that here the survey was taken or the data were delivered by younger people, older people. Literacy, digital literacy, were not as much as in Brussels able to take the survey. So it was a real challenge, and we had to deal with it. And we realized that in fact we had two different data strategies. And of course, if you want to compare two cities, you don't want to have different data gathering strategies. But that's what we had. And we noticed, and I've spoken about it, the influence that it had on the kind of data that we collected. But in the end, we found it more important, and I'm speaking here of Brussels in comparison to Melbourne, we found it more important to reach those people who normally are overlooked, the people with limited literacy, speaking a language that has no that is mainly a spoken language, and also people that have limited digital literacy. So we thought that it was better to have this difference in the data gathering than to leave out, in this case, the people with Amazigh language, and to have them in, who, by the way, were also very grateful that they could have their say in the whole research. Normally they are overlooked, so they were very grateful. All that to say that listening to users of translation can bring many difficulties, many methodological challenges, and we try to deal with it. And I'm giving you here the account of how we did it. I'm of course curious to hear how you relate, perhaps in your own research, but how you relate to the kind of choices that you make. And then last but not least, next to the users of translation, of course, you always also need, in this kind of research, you also need to listen to language mediators, to translators in all kinds of capacity. They must, of course, play part in any research on translation policy and the link with the practices and the beliefs. So here, what did we find? A common theme, both for Melbourne and for Brussels. Translators were telling us how important it was to have professional language services because it was important to ensure this equitable access to information and to services. So here, a quite common theme for the two cities that emerged. Also, translators in Brussels and Melbourne, they both had they noticed a disconnect between policy and practice. So the translators were well aware about the practices evolving and the policy staying what it was. And in both cities, they were raising, and I think this is what we could expect. They were raising concerns about specifically the employment of the non-professionals. And I think this was really a challenge for this group. On the one hand, they were seeing that these non-professionals, they could reach the community members, let's say, they could reach the community. So there was a very positive element, but on the other hand, yes, concerns about employment, concerns on the profession, and also on quality. So this was something that played very much, and it meant for us as researchers, it brought for us an extra, what I call here an ethical dilemma, because on the one hand, you want the policy to have effect. On the one hand, in such a crisis situation, you want people to be reached, especially the cult communities to be reached. But on the other hand, of course, you are you want to support the professionalization of the sector, and you are concerned about the broad use of non-professionals. So we did not have a solution, but we found ourselves there also in a kind of dilemma. It's perhaps a big word, but it was something that brought extra challenges to our research. Okay. This is where I try to come to a conclusion. If I try to summarize, and I hope you bear with me, but if I try to summarize the lessons that we took or tried to take from our whole research process, but because I really took you into the process that we followed, if I try to conclude, well, here are the main elements of the conclusions that we took. First of all, yes, policy restricts data. The most concrete example here, think of the language censuses that are absent in Brussels and that were available in Melbourne. Policy restricts data, and you can only work with the data that you have, of course. This is a no-brainer. Media reports, important, but of course they promote particular narratives. So information, yes, but true or untrue, that's something that you don't need to, how to say, even if it's untrue, it's there, but it's a particular narrative. Something that came along all the different roles that we studied, policymakers, translators, community members, and so on, they all have positioned interest, as we do have ourselves as researchers, I would say. But this is something that is really a challenge to take into account. You need to take it into account, and you need to triangulate it with the other elements of your research. So participants have positioned interest. Another conclusion. Yes, of course, the languages you speak can influence what you find. Very big difference between the Brussels situation and the Melbourne situation. But I want to add, it did not have a crucial effect on the main elements and the main conclusions that that we could draw, at least for our particular research situation. And then last conclusion that we took from this research, that was a real challenge for us. So these are conclusions in terms of challenges, of course, is that communities do not speak with one voice. And you could even enlarge it here, not only communities, but also policymakers, translators, and so on. And you need to take that into account in the whole of your research. So this is everything I wanted to share with you today. As I told you in the beginning, it's more about raising questions than about having answers. But I hope it is a bit of interest for you. Perhaps it has links with the research that you are doing. So I'm now really eager and curious to hear your questions, or to have your comments, or to have your critiques. But let me first stop sharing my screen, and we can then have a conversation. Okay. So I see a first hand. I don't know, Mustafa, do you want to do the logistics, or is it for me? Tell me.
Happy to do it. Thank you very much for an interesting and insightful presentation, Reine. Let's start with the first question, apparently from Dr. Fawaz. You will need to unmute first.
Yeah, thank you. Can you hear me?
Yeah.
Yes, yes.
Well, thank you, Mustafa. I think you are uniting the people from different spots on this globe. I'm talking to you from Ohio, from United States, and then you in Australia, and she in Brussels. And thank you very much for this very interesting talk on translation. Back to the pivotal position of language in communication. It is not translation, it is the communicativity of language used in translation. Now, my question to the presenter, to thank you for very attacking, I think, cornerstones in translation, the policies, the belief, and the practices in translation. Now, what is the role of artificial intelligence in these hot issues in translation?
Thank you for the question. Yes, important. I did not speak about it here, but of course we encountered this in our specific research. So I will first speak about the context that I spoke about here. We have seen how, let's say, all kinds of machine translation, that's perhaps a wrong term, but how they have been used in the COVID-19 situation, and how to a certain extent they did they did help. They opened up perspectives. It can also, for the authorities, then mean how to say, reduction of costs. Human labor is perhaps not in the end more expensive because the other solutions also bring cost with them. But we have seen how it's seen as an opportunity by the users and also by the authorities, of course. And there I come to the position of the translators. Of course, it brings a kind of dilemma for the profession. What does it mean for the profession? I think we have seen how the profession has changed already, how the profession is still changing. Post-editing, for instance, this is now in a more general perspective, but post-editing instead of translating. So I think as a profession we have to deal with it and to see how, although our role is changing, what are the possibilities for the profession, and then also for the programs that we are offering the students. How do we take all these new evolutions, and they are so quick, how do we take them into the programs to make our students ready for the future world? So I think we have no choice but to take these new possibilities into account. Of course, also with a critical eye, because the layman thinks what comes out of the app or what comes out of the machine is perfect, and often it's far from perfect. And I think there it's also a responsibility of the field to make people aware of the risks and the challenges that are still there with these at first sight perhaps perfect solutions. So I think with an open eye, but with a critical eye, we as researchers and we as people in the field, we need to steer also, or to help to steer the evolutions. I would say that would be the at least for me, the best way forward. We cannot how to say, we cannot do as if they don't exist. They are there and they are used, and we need to be preferably ahead of these evolutions, but that's perhaps even more difficult. Is that the kind of answer to your question?
Thank you very much. Now, another question or comment from Clara?
Yeah, thanks very much, Mustafa, for organizing another wonderful talk, and Professor Meylaerts. It's very nice to meet you. Thank you for a very inspiring presentation. I'm Clara from Hong Kong Baptist University. I've been doing similar research with NGOs and the linguistic minorities of South Asian backgrounds in the Hong Kong context. I really shared those. I also encountered a lot of those methodological challenges that you shared over here. I have many questions, but maybe I'll just raise 2 or 3 over here. The first one is, as you mentioned, policy is context. It's also contextual. So the policies in different cities, in different regions vary, and also even, for example, in a city like Melbourne, where I actually used to live in, I wonder if if you have any suggestions as to policy-related research, if there is a void, not a complete void, but very limited guidelines, policy guidelines, especially institutional policy guidelines in this kind of research. And then the other one is about the institutional stakeholders, institutional policy makers. Do you have any advice as to, because how to access them? You know, in different regions, it might be challenging to actually get hold of them and to talk to them. This relates to what you shared about they are the they may not feel comfortable sharing, reflecting critically on the policies. So I will actually have other questions, but I'll stop here. Thank you very much.
Okay, thank you for these questions, and you can share your other questions if there is no time now. You can email me, or we can have a bilateral conversation. Let's wait and see. Perhaps you can ask them later here in this in this lecture. Anyway, your first question, yes, policy is context dependent. You are speaking about very limited elements of policy that are addressing the things that we need. Yes, definitely so. In general, I would say, if there is an explicit language policy, there is very little about translation in language policies in general. But of course, that should not prevent us as researchers to, let's say, kind of read in between the lines, because implicitly, of course, it's all about translation also, even if it is not named. And I think that's a task for us as translation researchers, to make clear that it is all about translation. Also, you might remember, or you might be familiar with my slogan. It's not more than a slogan, but there is no language policy without translation policy. So it is there, even if it is implicit. So that's something that is our task as translation policy or as translation scholars to make people in the field, but also policymakers aware of that. It is also our task, and there I agree, for instance, with Sharon O'Brien and Federico Federici. They have very interesting publications on that also. The fact that in crisis situations and in policies on crisis communication, there is nothing about, or on crisis, there is nothing about communication, let alone that there would be guidelines on translation in crisis situations. So communication and thus also translation is absent. But there, once again, I think it's important that we as researchers make society, make policymakers and so on, make them aware. That's not an easy task, but I think it is our responsibility. And by repeating these messages, I think we can only go forward, because the stakes are high. The risks for society are very high. There are good studies on what are the risks for society if you don't have a good language and translation policy. But yeah, I think there is a big task for us. But I completely agree that it is very limited and that it is absent in most of the cases. And that brings me to your second question, these institutional stakeholders. Yes, of course, it's very difficult to access them. We had these same problems. How to access them, I think you can only try. And if you have good arguments, hopefully they are more open to share at least their meaning, even if it's only the official viewpoint. But from a methodological viewpoint, I think also the data that you cannot have, the absence of information is so important, is so telling. And I think in every research we should thematize, is that a good English word? We should thematize absence. What don't we have in terms of data? What was impossible to get access to? Who were the people that were not responding? this is very relevant in every research, and I think we don't take that into account as much as needed. I always give my students the example of if you do a kind of test in a laboratory, you mix two liquids, and either the laboratory explodes, so to say, that's one extreme, or nothing happens. But if nothing happens, that's also a result. And I think in the humanities and in the kind of research that we do, you also should take that into account. Of course, we want data, and we should do our best to reach the policymakers in this case. But if it's impossible, well, that's also a result. Anyway, I speak too long. I hope this is a kind of answer to your question.
Thank you. We have
very helpful.
just a second, please. We have a written question from Sam Berner, and then we'll move to Javier Moreno. Sam says, translators, at least in Australia, are also members of their communities. What was their role or perspective on the COVID-19 communication as such community members, not as or maybe despite of being professionals?
Yes, very good question. There were interesting insights in the sense that the role of a professional translation. I try to summarize the insights of the results that we have or that we had.
Maybe when you asked these translators, you asked them wearing a specific hat. So when you ask them as translators, they probably express themselves as professionals. They don't speak as members of the community.
It was more mixed. It was more mixed. And in terms of the role that you have as a translator, let's say to be impartial, to translate what well in interpreting, for instance, but because many things in COVID were also, of course, through interpreting. It was a kind of mixed position. Like I'm a member of the community and I'm a professional translator, but if needed, I will adapt my role more towards community member in order to not to lose the one who I'm speaking to build trust, while not forgetting about my role as a professional translation and my code of ethics. So we had many, let me call it intermediate positions, so to say, and evolving or switching a bit more to one aspect of the role than to the other, according to the situation. So it was in that respect quite interesting. We found how these roles were often, can I call it combined? Not easy for the people themselves, though.
Thank you. Javier?
Hi. Well, first of all, I wanted to congratulate you and the whole team for such an ambitious project, because I think it's incredible to do all this within such a limited time frame. I'm really interested in the third tenet, sort of say, of translation policy, as in the beliefs and ideologies. And when you were mentioning about the institutional authorship, and Clara was also referring to that before, and how when we research institutional multilingualism, we have an official discourse, but there's also sort of hidden ideology and beliefs. And I'm really interested, and not just in this project, Reine, but in your entire career. How do you think, and this is a really open and broad question, how do you think that we could navigate researching these hidden ideologies when we're interviewing stakeholders? Because of course, when we're conducting semi-structured interviews, we're trying to garner views and views on translation. How can we divert from the institutional discourse to kind of grasp what the actual individual ideologies are behind the use of translation? How would you best approach it?
Mm-hmm. Very good question. Thank you. Difficult question also. I would say in trying to combine, let's say, a general approach. I mean, so speaking to many people, speaking to many policymakers, both in group and individually. So going broadly, but also going, is that good English, deeply. So more than one interview, if you have bilateral interviews, more than one interview with one and the same person, because it's not different from doing translations or doing interpreting. You build a kind of trust relationship where then people can, sometimes you don't know one beforehand, it's all trial and error, but where then people can kind of disconnect from the official role, so to say, and give their personal opinion, which then sometimes can differ from the official role. And I'm thinking here of a specific example that our Brussels researcher, but also the Melbourne researcher had. So first on Brussels, yes, Khadija was speaking to a former minister in Brussels, who in fact was saying, yes, I have installed this commission to see what further steps can be taken in terms of the policy, the language policy in Brussels. This was not related to specifically COVID, and I feel the need, but it's not really possible, you see. So she was reaching towards this, let me call it more individual. And the example that I gave in my talk on Melbourne, where these policymakers who were saying, in fact, we had no policy, we throw money everywhere and so on. So yeah, I know I'm very general here. It's about trial and error, but still, as a methodological approach, I think it's good to go widely, but at the same time to go deeply, and then to triangulate these policymakers' views, official and individual, so to say, to triangulate them with, let me call it the facts that you find. How many people are left behind? How many medical miscarriage do you have related to the policy? What is the cost of not providing translation? So many elements can be brought into the arguments, and I think that's once again our role, to bring these arguments, to bring the results of research into the discussion, and to try to to make them more aware, and then to open up. But yeah, that's the only thing I can tell you. Sorry.
Reine, if you don't mind, we'll take another question from the
Sure.
box, and then we can close with a question from Miranda. Okay. Aisha says, I recall that there was a high level of distrust in many CALD communities in the Australian context, largely due to misinformation on social media and word of mouth. Was this a noticeable theme in the Brussels context?
Yes, yes, definitely so, and unfortunately so. And I think this is really a lesson that should be learned from this crisis communication, because it's not only the fact during a crisis, it's the general situation in multilingual, very diverse contexts, and we as a society are leaving people behind, and we should not do that. So it should become better. Why did people turn to alternative communication, or to alternative facts, or to COVID messages from their home country, which did not apply to the situation in which they were living? Because there was this distrust, because in normal situations, they are not reached either. So I think as a society, we have a big responsibility there, and it's really very confronting, not to say painful, to see how this was also the result of by the way, the two PhDs already. So, but they both noticed how after COVID, everything turned to normal. But normal is that there is even less translation, that these communities are even less reached. So I think the distrust and the fake news and so on, it has a reason, and we should tackle this reason. And I think we as language and translation scholars, we have tools. They will not be sufficient. They should be combined with other tools, but we have tools to make progress there, and we need to convince the policymakers.
Thank you again. And Miranda, you have the last question or comment.
Question. Thank you so much, Reine, for sharing your research. It's just amazing. And also, it really is a very good reminder for us who do research in the area that the issue is multifaceted, and also it's complex, it's nuanced. So thank you so much for sharing. My question for you is, after all the learning from your project and from, what all of us have experienced throughout the pandemic, touch on wood, it doesn't happen again. But if another disaster happens, I'm interested in knowing whether you think that we have done all the learning and we have shared with all the stakeholders that when the next disaster comes, we will do better.
Well, I always try to be positive, and I'm positive. I'm a positive person, but here I would say I don't think so, because in order to do better in the next crisis, and there will be a crisis, there have been already crises, the big fires in certain places, for instance. So in order to do better, you need to have the basic non-crisis communication. You need to make progress there, and I don't see that in the places we studied, but according to other studies, no. So once again, I think there, as far as language and translation is concerned, there we have a big task as translation scholars to raise that awareness and to try to take steps there. But it's an ongoing battle. It's an uphill battle, so to say. But hopefully this kind of research, we will have policy advice to the policymakers as a result of the PhDs, which need to be defended still. So it's not out in the open there. But that's the way you try. I've seen that with certain NGOs also, and their translation policy, they have changed it. They have made it better. So progress is possible, but yes, we should not rest.
Thank you once more. It has been a pleasure and a privilege to have you among us, and thank you everybody for participating and also for engaging with the speaker with such interesting questions and comments. And I look forward to see you in the next one. Thank you.
Thank you all. I'm really very grateful for your attention, for your being there, but also indeed for the very interesting questions. That's very rewarding for me also. I've learned also a lot. So thank you so much. Have a nice day or a nice evening wherever you are.
Thank you.
Bye-bye.